Hi, Brianna Lujan from VN49, the AM class. This is going to be video number 3, but I'm going to probably cut this one in half just so that it's not too long and that it'll be easier to send. But I'll talk about the removing staples and sutures and the sterile dressing change, wet to dry dressing change in this video. So for the removing staples and sutures, the proper technique for removing staples and sutures, first of all, a medical order is required to remove the staples and sutures. You can't just do it if you think the wound looks like it's ready for them to be taken out. No, a medical order is needed first. But obviously you start out with hand hygiene. Put on gloves. Remove the dressing and throw away into a plastic waste bag. Perform hand hygiene again, and then you want to assess the wound. If it looks a little crusty and like there's dry blood around the wound, just gloves, and then clean with a sterile gauze that has a normal saline, and you just want to kind of dab around it. You don't want to, you want to just dab around it, get it clean, and just get it ready for removing the staples or sutures. So I don't know if you wanted, I have all three. I have sutures, staples, and sutures. So for sutures, you want to use forceps. You want to use it with your non-dominant hand. So for me, on my left hand. And then you have suture scissors with your dominant hand. So you want to use the forceps to lift the knot up and away from the skin. And then you want to get like the curved part of the scissors with this dominant hand and go under the knot and then just cut them. And then you want to just keep pulling. So as you cut, you want to just pull away with the forceps. And then once you remove that, you want to remove every other suture. You don't want to go one right after another because the skin might start tearing apart. And for staples, you're going to use the lower jaw of the staple remover. You put that all the way under the staples, and then you just kind of clamp, and that will make the inner part go, so instead of like this, it kind of goes down. You're cramping it. So then you just wait for the outside, the ends, to just come up, pull away from the skin, and again you want to do the same thing. You'd want to do every other one. And then if they have staples and sutures, at the end you want to clean with an antiseptic sponge, gently clean around the site that might have a little bit of dried blood that you didn't get before. And then you want to put like a dressing over the site, but it has to be ordered for the dressing. And then you want to place all the used supplies in a discard bag and remove gloves and perform hand hygiene once again. And for the sterile dressing change from wet to dry sterile. Okay, so this is a sterile technique. You want to obviously prepare your workspace because since it's sterile, you want to make sure it's clean. So you want to take your kit and open away from you, and then you want to get the gauze that's on the patient. You want to pull it away because you don't want to rip it off to tear skin off. So you pull it away and then you just throw that away. And then you take off your gloves, hand hygiene, glove again. You're gonna have your sterile wetting solution, and then you're gonna put that into the basin of your the sterile container, the plastic part. You could just put it in there, and then gloves, and then you put on your sterile gloves. And then you place the dressings into the solution and kind of just let them sit in there a little bit, soak up some juice, and or I guess you could just pour the solution on top. And then you want to wring them out, and then you kind of want to like a little fluff them up a little bit, not so that they're completely flat. You want to get them a little bit of fluffed up, and then start covering from the inside of the wound out, just making sure everything is covered. And then you want to get a dry sterile gauze and kind of just lay it on top. And if you want to keep it dry, well, you want to make sure you keep the outside dry, so you keep using more gauze to just cover up, make sure none of the solution is leaking out. And then after that, remove the gloves, discard them, and then add the tape around, make sure everything looks good, perform hand hygiene, and you're done.